Thanks a lot to everyone. I'm Federico Vozzi. I'm a researcher of National Institute of Clinical Physiology in Pisa from National Research Council. And I'm the technical manager of Alternative Project. And this is the second webinar that we propose inside the cluster activities organized by European Commission and collecting the 6 project of the European Green Deal with a quite similar aim. I just shared just a moment the agenda of today. So as you can see, we have this brief introduction. Then we start with Dr. Anita Sosnoskova from QSAR Labs, representing Promises. Then we have Silvia Esker from Fraunhofer that represents European project. A joint presentation by Dimitra Varsu and Periklis Tirtsos from one from Nova Mechanics, the other from N2A, representing scenarios, and then Alessandro Roncaglioni from Mario Negri Institute, representing Alternative Project. At the end, we will do a session of question and answer. Just to warn you in some way, Dr. Sonoskova and Dr. Esker should leave and will not participate to the session of questions before previous work commitments. So for any question, please email them to them and they will reply to you. So after this, I think that we can start with the first presentation. I stop my screen, and I introduce Anita Sosnoskova. She's a team leader at Senior R&D Specialist at QSAR Lab. She has a background in computational toxicology, a specialist in chemometrics and chemoinformatics. Her work is focused on the computational assessment and design of new and safe chemicals. She's leading the team working on the development of new methods for computer-based assessment of risk posed by new chemicals and materials, including nanomaterials, to human health and natural environment. So, Anita, the floor is yours.
Yes, thank you very much. Can you see my screen?
Yes, yes.
Yeah. Okay, so thank you very much for introduction. I would like to present the results obtained within the Promises project. Sorry. Can you see the second slide? Or
yes, now, yes.
Okay. So QSAR Lab is a part of a Promises project granted under Horizon 2020, and the objectives for Promises are, among others, the improvement of the predictability of the persistency and mobility of persistent mobile compounds, and improve the assessment and management of human health risk associated with the exposure to PFAS and persistent mobile and toxic compounds. And our main activities within the Promises include development of new computational tools allowing for predicting the physicochemical properties, but also toxicological endpoints, mainly for PFAS. Among the computational tools recommended by European Commission are mathematical models that quantitatively describes the the relationship between the chemical structure of compounds and the activity or physicochemical properties of those compounds. Those methods, so quantitative structure activity relationship methods, can be used for obtaining missing data describing modeled property. The aim of QSAR is based on the development of mathematical model that quantitatively describe the mutual variability mutual variability of the chemical structure expressed by so-called structural descriptors, and the properties of the chemical compounds. So to develop the developed QSAR model, we need to have a set of compounds with defined chemical structure. So we have to have numerically described particular features of the structure. And for this set of compounds, we also have to measure the activity. Then, using various machine learning algorithms, we developed we try to relate structure with activity, and at the end we developed a mathematical equation that can be applied for prediction of the properties, modeled properties for new yet non-tested compounds. Within a PROMIS test, we would like to deliver predictive tools for estimation of the toxicity of PFAS. Therefore, the first step was to perform the literature search and find what is available in this context. We collected and evaluated all available QSAR models that contain PFAS in the training set of those models, and then we evaluate them based on the golden OECD principles for QSAR model validation. According to those OECD recommendations, each properly developed QSAR model should have a defined endpoint, should have a clearly defined algorithm. So all steps that have been taken for developing the model should be should be described in such a way that this model can be repeated in the future. The model should have defined, assess the applicability domain, so the chemical space in which the predictions will be reliable. Also, all statistical parameters should be calculated and interpreted, and if possible, the mechanistic interpretation should be also included in such a good QSAR model. And only models that fulfill all above mentioned requirements can be used for predicting biological activity, for example, for supporting the registration of the substances. The need for adequate and reliable documentation of developed model is properly met by the use of developed standard reporting formats, so QMRFs. These are QSAR model reporting format, which summarize QSAR model and those reports provides key information about model according to the 5 OECD validation principles. And coming back to our analysis, we found in the literature 16 QSAR models that contain PFAS in the training set. 8 were for toxicological endpoint, and the other 8 for ecotoxicological endpoint. And then, in line with the OECD golden principles, each collected model was evaluated in terms of the availability of information on each of OECD principles. And as a result, 9 out of 16 available models were scientifically valid. So they can be used. They are ready to be used for to predict the activity of new compounds. The rest of the models can be used to gain knowledge about the studied phenomenon, but they cannot be used for example, registration purposes. The analysis showed that there were no major problems with the fulfillment of the first and second OECD principles, So the endpoint and algorithm was were clearly described. But there were problems with assessment of the applicability domain or with availability of data for training and validation, or statistical parameters were not interpreted or were not calculated. Basically speaking, the analysis showed that the only reliable QSARs which were ready for predictions for new compounds were for acute inhalation toxicity and acute oral toxicity. We know that there are more specific evidence that PFAS can act as, for example, also as an endocrine disruptor. So it was surprising that for such an endpoint that there were no reliable QSARs. Nowadays, with the increasing need of knowing the mechanism causing the adverse outcomes, the developed QSAR models should also follow this trend, and they have to give a deeper mechanistic interpretation, so which is in line with AOP. So maybe it is necessary in the future to update the fifth OECD principle and indicate what exactly should be included in the interpretation of the QSAR models. Secondly, the available QSAR models, as I said, focused mainly on the acute toxicity. So they do not indicate a clear relationship between the structure of PFAS and the adverse outcome pathways or molecular initiating events. And in fact, they only explain the basic structure-activity relationship, but do not indicate a real mechanism of action. The other issue connected with the available developed model is the experimental data for training and validation of the model. Although PFAS are a very large group of compounds, there is a list that there are more than 5,000 or 12,000 compounds. Experimental data for relevant also physicochemical and toxicological endpoints are available only for a small group of those compounds, which does not represent the equally different group or classes of these compounds. In such a case, there is an option for development of local QSAR models and then try to rescale it for other group of PFAS. But also where it is possible, we can use the quantum chemistry methods for simulating for example, physicochemical endpoint, but also we can use molecular docking and simulate the interaction between PFAS and the receptors, and then use those values for training the models. In the second part of our study within Promistus, we deliver the tools for assessing and screening PFAS if they have a potential to bind to the nuclear human receptors. For this case, we have applied an integrated computational approach consisting of several steps. First, we collect most commonly used and analyzed PFAS. Then we applying free available software, we calculated binding scores for this set of compounds. Using these binding scores, we developed QSAR models. We focus on 5 receptors on PPR alpha, beta, gamma, and TR alpha and beta. And after evaluation the model, we applied it for virtual screening of more than 4,000 PFAS contained in the Norman database. And as I said, we've developed 5 models. Here are just 2 examples. All of these models were based on the same set of compounds. We use 2-dimensional descriptors, so everyone can easily calculate it from the SMILES notation. And in each model, there were 2 descriptors, one corresponding to size and or branching of the molecule, and the other directly or indirectly indicated a fluorine content of the molecule. After developing the model, we implemented them into the external data set from the Norman database system, and we predict the binding probability based on the selected structural features. Based on docking studies, on docking scores obtained in models, we assigned each compound to the class according to their binding probability. So we had red, orange, yellow, and green color corresponds to high, moderate, and low binding probability. We visualize the relationship in the score plots where X and Y axis corresponds to used descriptors in the model. And as a result, we obtained that we can summarize that the chemical structure of PFAS, so carbon chain lengths, the number of fluorine atoms, and also the number of branches, so the shape, may have an influence on binding to the selected studied receptors. In case of PPR alpha, beta, and gamma, activation of those receptors increases with the increasing chain length of the carbon saturated with fluorine. But in case of TR receptors, so TR alpha and beta, both shape and size of PFAS molecule and percentage of fluorine atoms have an impact on the binding strength to the thyroid receptors. The obtained results are in line with biological studies. Here, the differences observed may result from the limitations of the in vitro assays, mainly the possibility of activating receptors through the binding of PFAS to the alternative binding sites. In our opinion, also compounds from the Norman database includes various specific specific elements and functional groups, and those developed models are rather suitable for linear perfluorinated compounds. In the next step, we applied the above-mentioned approach for virtual screening of PFAS in terms of their binding, in terms of their potential binding affinity to other 12 nuclear human receptors. And we calculated the binding scores. We developed QSAR models, and then we applied those QSARs for virtual screening. And these are the results. So we grouped those developed models in terms of used descriptors, and also we assign each predictions for PFAS into the class of the binding probability. Each model included a structural property of the molecule describing size and branching of the compounds, and a property describing the fluorine content. We subdivided this set of QSARs in terms of the probability of binding to the receptors, and we can conclude that in case of PPR alpha, beta, gamma, also glucocorticoid receptors, liver-X receptors, and retinoid receptor groups. They are those groups are unaffected or slightly affected by PFAS. So here we can see that there is low or moderate binding probability of PFAS to those receptors. But the analysis showed that most PFAS reflect a high binding probability to sex hormone receptors, so anti-AR, ER, alpha, beta, and also anti-ER, alpha and beta. And also in case of thyroid receptors, around 500 PFAS reflects a moderate high binding probability. Several experiments studies can be found in the literature, and most of these studies confirm the influence of the characteristics described by the selected descriptors on PFAS receptor binding strengths. So our results are in line also with experimental results, and we indicate that size, presence of branching, and substitution of the carbon by fluorine is important in this interaction. To sum up, using structure-based approach, we confirmed the detrimental effect of long-chain PFAS on the binding to the nuclear human receptors, regardless of the receptor tested. Using this methodology, this approach, it is possible to select from a large group of compounds those that should be prioritized for experimental investigation, and also this such approach gives a general idea of which part of large group of compounds is potentially harmful, and on the other side, which hormone receptors are most at risk from PFAS. And for the future perspectives, of course, the more experimental data for PFAS will be available. It will help for improving the developed QSAR models, but also it will help with interpretation of such a structure-activity relationship. Okay, and so yeah, this is the end of my presentation. I'd like to thank for inviting me for this webinar and give the opportunity to present the PROMISES computational activities. And also I would like to thank to my team from QSAR Lab for performing the presented studies, and thanks to Harry Besseling and Peter Benish from Biodetection System from BDS for supporting us with biological and toxicological aspects of those studies.
Perfect, Anita. Perfect in time. Thanks a lot for the presentation. So we can move to Silvia with her presentation on PBK modeling for in vitro to in vivo extrapolation. I forgot to say before, when I left 2 minutes, I will advise you, I will tell you to all the presenters and just to advise. Okay? Yeah. So Silvia, please go ahead.
Yeah, thanks a lot. Yeah, I changed the title a little bit of my talk because I thought it's a bit more logic to call it in vitro to in vivo extrapolation, how we used toxicokinetic assessments in the ZeroPM project. As nicely introduced already, my name is Silvia Eschert. I'm working for the Fraunhofer Institute in Hanover. It's not moving, here. And here I'm head of the department in silico toxicology. And I will not give an overview about the entire ZeroPM project today, but I will just pick out one specific aspect, this kinetic assessment. But here you can see, and I have to apologize, this is really a high-level overview of the ZeroPM project. So here we in the ZeroPM project, we want to prevent, prioritize, and remove persistent and mobile compounds in different work packages. And the coordinator of this project is Hans-Peter Arp, and he is supported by Sarah Hale as you can see on the slide. So we will not look into these details, but we will have a little bit of an introduction. And I thought it might be good to just remind us what are persistent and mobile compounds. And here we see 2 recent UBA reports, also edited and issued by Hans-Peter and Sarah. And to be very brief, I think persistent compounds can be summarized as compounds that have an extreme long half-life in the environment. And some of them are also mobile and can enter into the drinking water. So like this, they are of potential concern. And some of them then are also considered to be toxic to humans and or the aquatic system. And this explains us how we categorize them as PMT, persistent, mobile, and toxic, or very persistent and very mobile. In these reports that you can see here on the right-hand side, about 340 compounds were classified as PMT or BPVM substances. And what we can also notice, there's a long list of compounds in this report. About 34% of all these compounds do not have any compound-specific hazard data, so it's actually an issue to classify them according to their toxicity. And this is one of the goals of 0PM, to develop a prioritization approach using new approach methods. This means we will use NUM data, so anything in vitro and in silico predicted, to come up with a classification for T toxic. And I will, so to say, explain this briefly to you, but I will mainly focus on the kinetic assessment today. So we think that we are not able to test all these data poor compounds in animal studies, and therefore we will mainly apply next generation risk assessment for those compounds. And here you see also a high-level overview how we think next-generation risk assessment can be organized. So we have one part where we do the hazard identification. Here we would really like to learn what are the type of effects that these compounds induce in the humans in this case. And then we have another bit on the right-hand side, which is hazard characterization. Sorry, here this is a typo. And here we want to know at which dose do these compounds cause this effect, and we have to integrate both into an integrated assessment testing strategy to come to a conclusion. For the hazard identification, next generation risk assessment is mainly using in vitro and in silico models to identify the type of effect. And here we see as one placeholder an AOP, which organizes different types of evidences in terms of key events to an adverse outcome. And on the right-hand side for the hazard characterization, we see the PBPK model, which is used to come to a kinetic assessment. And we will now mainly focus on the right-hand part, the hazard characterization. So as I told you, 0PM is working also very much on the P&M criteria. Today we will look into the toxic criterion. So here we want to develop a screening and prioritization concept. And to do this, we have selected data-rich model compounds that fulfill the T criterion, so as proof of concept to see how good we are with prioritization and screening in our method. Then Freer University, the group of Team Mohammad, they are working on this in vitro test battery to do the hazard identification. So they selected different in vitro assays to address different toxicological endpoints like endocrine activity, reprotoxicity, and specific target organ toxicity. And here we speak about liver mainly. Then we will perform in vitro to in vivo extrapolation to derive human equivalent concentrations. And in the end, we will also compare this to modeled exposure scenarios. And this is mainly done by Todd Gunn, I think. Today, we will look into these two aspects because we are looking into the kinetic part of it. And I will, so to say, talk you through this. So we selected data-rich model compounds, which allow us in the end to assess whether the modeling that we are doing also resembles somehow a reality. And here we selected three data-rich groups. We work on triazines. They share this structural element over here. We also work on triazoles and also on PFAS that were already introduced by the previous speaker. We work on these parent compounds. They are given here in blue, in black, and we also have some metabolites included, like here melamine for the triazines or 1,2,4 triazole for the triazoles. Data rich means that these compounds have in vivo animal studies. They are mainly extracted from EFSA risk assessment reports or draft risk assessment reports, and they were added to the REPTOS database, which is the database on toxicological in vivo studies from Fraunhofer ITEM. And we extracted mainly data for 3 toxicological endpoints, which are repeated dose toxicity studies ranging from subacute to chronic oral exposure, also some developmental toxicity, and in vivo ADME studies. This is a concept, so we will test a few data-rich compounds, like here we see the triazines, and then we will predict based on the concepts that we will establish, so the modeling that we will do and prove that they are correct, also predict then other triazines that are data poor. So we will use a read-across approach to predict the remaining compounds so that we do not have to test all of them. Now we go to the in vitro to in vivo extrapolation that we will use, or that we are using in 0PM, and it's summarized on the slide. So as I told you, we will get hazard identification from, we are getting data on hazard identification from Freie University, and here we usually get a dose response curve, which describes us an in vitro activity. And in the first step, this in vitro activity is corrected for the with in vitro biokinetics, and I will explain to you in a second what this means. Then we calculate the free effective in vitro concentration, and then we extrapolate this to the corresponding human plasma or tissue concentration, and then in the end you can also model it by reverse dosimetry to the external concentration or dose that humans have to see to have the same concentration that has caused the in vitro effect. So first of all, we look into the in vitro biokinetic approach. Here we have several options to do this. First of all, you could measure actually what enters into the cell and then use this for your prediction. But you can also use several models that are available and have been nicely reviewed recently by Brönker et al. And here you see an overview of a lot of different existing in vitro biokinetic models. They differ in complexity and applicability domain, and for 0PM we decided to use one of the most recent models, which is the VIVID model, which has been developed by Certara. Here you can see the publication. This is a slide adopted from Kieran Fisher and Barira Islam from Certara. And what does this in vitro distribution model do? It is, so to say, accounting for differences in the in vitro setup. And we see this illustrated on the slide. On the left-hand side, you see a well where you have some cells, a certain cell type. Now you dose your compound into the medium, and then the compound sees, so to say, the plastic surrounding. It also sees some proteins probably being included into the medium, and it's probably also, based on its property, evaporating to air. And these are the 3 culture-specific conditions that the in vitro distribution model takes into account. So it's, so to say, calculate which part of the concentration is binding to plastic, which part is binding to proteins, and which part is evaporating. And this leaves us then with the free medium concentration. And in the last step, then the free medium concentration has probably to partition into the cell line. It is shown over here. Mainly the unionized fraction will, so to say, partition into the cell, and then you can calculate the intracellular concentration. And if, so to say, your target is in the cell, then this might be the most relevant concentration as starting point for your in vitro to in vivo extrapolation later on. So the assumption is for the in vitro to in vivo extrapolation that we need the free unbound concentration because this causes the toxicological effect or the biological response. And we will not, so to say, use a nominal concentration, but we will take into account all these confounders like binding to plastic, evaporation, binding to proteins. Then the free medium concentration will be a little bit lower, probably, than the nominal concentration. And then this is a starting point to calculate the intracellular concentration, which might then be a little bit higher again because the compound might accumulate in the cell type. Here we see one example or 2 example compounds. I told you that we are working on 3 compound classes, and azoles, quinazoles are one of these classes. This is done by Abhishek, a PhD student, and here you can see for phenbuconazole and tibuconazole, we had a nominal concentration in a certain receptor antagonism assay. And when you then calculate what part of the nominal concentration is in the end predicted to be intracellularly freely available, you can see that in this specific case, the concentration in the cell is higher than the nominal concentration, so the compound is accumulating in the cell. Both compounds are not ionized at the pH that is taken into account. They are also not volatile, so the prediction is very much driven by their lipophilicity expressed by their log POW value. So intracellular accumulation is predicted. The next step is now to compare this estimated value to measured values, and we will get measured values from TZW from the group of Nicole Zumbulte. So we have now learned how we will address the in vitro biokinetics. Then we go for the PBPK modeling to calculate the human equivalent dose. This is the next step. And this is shown over here. So what we usually would like to have are in vivo ADME data to see which part of the compound is absorbed after oral uptake, for example, and then eliminated from the human organism or any organism. And we can then have some descriptors here, like the maximum concentration that is reached after a certain time point, and the area under the curve, which is everything here under the blue curve. So we have an absorption elimination phase, and these are the things that we are interested in. But for many compounds, especially for many chemicals that we find in the environment, these in vivo ADME data are not available, so we have to use something else. And here PBK modeling comes into play. PBK stands for physiologically based kinetic modeling. This is a model structure. This is some model that we developed at Fraunhofer ITEM, but we have many others around. It is, so to say, breaking down the organism into several compartments, like here, heart, brain, muscles, skin, liver, and most importantly for us at ITEM, the lung. And it simulates the absorption, distribution, metabolism, and elimination in these tissues and in the plasma. All these compartments are connected via blood flows so that you can, in the end, model the mass flow in the organism. You need 3 different types of parameters to model these things. So you need the physiological parameters to describe the different compartments. You also need compound-specific ADME data. And in the end, you also need exposure data for risk assessment. In 0PM, we are going to use bottom-up approaches because we have no in vivo ADME data. We cannot fit anything to existing ADME data. We will, so to say, parameterize the model by compound-specific in vitro ADME data. And this is explained here. So the generic data that we need are, on the one hand, the anatomical data describing all the organism, like absorption, inhalation, frequency, breathing rate, distribution, and so on. And on the right-hand side, we see that you also need, for the specific compound that we are going to address, specific ADME properties. So how does it partition into the different tissues is one question. What is the absorption rate? Is it biotransformed in, for example, metabolized in the liver? Is there any binding observed? For example, does it bind to proteins in the blood, like albumin? And how is it excreted? And here we will use, or we are using in vitro ADME data. Here we see again an example. This is very much work in progress. So we see an example for siromazine. This is one of the triazines that we are interested in. And you can see that we have measured in vitro the uptake via a barrier model. In this case, the uptake or permeability was measured in a CACO2 assay. In vitro with a human cell line, then we also measured intrinsic hepatic clearance. So is the compound breaking down in the liver? In this case, it was very persistent, so not breaking down. Here we take data from COMTOX, but we are also measuring these data now in 0PM. So this will be, so to say, replaced later on. We have data on fraction unbound, data on blood plasma ratio and ionization status. Again, this is not ionized at the relevant pH values, and this is estimated by ACD Labs. So we have a bunch of different properties from different sources, and now we use this to parameterize the PBK model, and this is shown over here. At the moment, we are using a rodent model because we have in vivo data for rats, and these in vivo data are shown over here. But this is a typical rat study with gavage exposure, and you can see which type of plasma concentration has been measured over time. And here you can also see the prediction obtained currently by the rodent model, which is not yet perfect because Cmax is a little bit under-predicted. So here, when you compare the PBPK to the in vivo data, you can see that Cmax is under-predicted and also the area under the curve is under-predicted. So this is something that we need to find out now in the next steps to make the prediction a little bit better. At the moment, this model is still a little bit uncertain. And we think we have some points to address here. So the next steps are that we will do a sensitivity analysis of the parameters that we use in the rat PBPK model, and then do also the uncertainty assessment to say from which point on the model is good enough to model this compound and also related compounds. We will have to work a little bit more on the extrapolation then to the human PBPK model, because in the end we do not want to predict the rodent, we want to predict the human. Then we will use the human PBPK model to estimate the human equivalent plasma concentration starting from the effective in vitro concentrations, and this all will be used during the tested compounds based on the human equivalent concentrations. So this was my last slide, and I'd like to thank the ZeroPM Consortium, and I'd like to thank you for your attention.
Thanks, Silvia, and sorry I didn't introduce you before before your call, your presentation. I'm sorry.
That's completely fine.
Thanks a lot. So now we move to the joint presentation by Dimitra Varsu and Perikles Tsiros. Dimitra is a senior researcher in Nova Mechanics. She undertook her PhD in nanoinformatics from the School of Chemical Engineering at National Technical University of Athens in Greece. She's focused on the development of computational machine learning workflow for the prediction of properties of small molecules and nanomaterials. On the other side, Perikles is a chemical engineer also from National Technical University of Athens, and now has his master's in data science at the Department of Informatics and at the University of Economics and Business in Athens, and is doing a PhD in stochastic modeling and control system bioscience in the unit of process control and informatics. So guys, start for first Dimitra and with his work with Analogous Cloud Platform, deep learning and machine learning models predicting PPAR binding affinity and cytotoxicity. And then we have Perikles with developing biokinetic models, algorithms, and web application in scenarios. So as I said before, 10 minutes for each one, and if for you, when I left 1 minute, I will call you in case. Thanks a lot, guys.
Thank you, Federico. I guess you can see my screen.
Yeah, we see.
Thank you very much. So I'm Dimitra Danai Varsu from Nova Mechanics. And today I'm going to present you 3 models that we have developed under the Scenarios project. I will start with a brief overview of the Analogous Cloud Platform, and then I will present you the machine learning and deep learning models to predict peroxisome proliferator activated receptors, PPAR, related endpoints. PPARs are of particular interest as they are a group of nuclear receptor proteins that regulate the expression of genes. This work is part of 2 publications that are under preparation currently. And as I said before, they are part of the Scenarios project. The Scenarios project is developing new technologies to detect, monitor, assess the risks of and clean up PFAS. And this project is helping pave the way for a future with zero pollution from PFAS and other organic chemicals. So our goal, the goal of is to develop different machine learning and deep learning methodologies and offer them to the community. So through the Analogous Cloud Platform, we can deliver high-quality machine learning models and other computational tools under a user-friendly environment. So any user, regardless of any coding skills, can benefit from the available tools. In this case, the goal is to use as an input the chemical structure of any query molecule, like a PFAS molecule, and generate and acquire the PPR-related endpoints in no time. As all the functionalities, the calculation of the necessary molecular descriptors and modeling is performed in the background. So this is an instance, a screenshot of the Enalos Cloud platform. It's free of charge, and you can access it through this link. And all the models that are developed under the Scenarios project can be found under the Scenarios instance of the Enalos Cloud platform. And I will start with the first model. It is a machine learning read-across model for the prediction of the biological potency of novel PPR delta agonists. So this is a robust read-across model. It was built in line with the OECD guidelines. And we retrieved data from the PubChem database using our in-house tools, the Enalos tools in the Enalos 9 nodes. The data we have extracted refer to the biological potency of PPR delta agonists in human embryonic kidney cells. PPR delta are nuclear hormone receptors that govern a variety of biological processes and may be involved in the development of several chronic diseases. And so we wanted to predict the PPR delta potency based on molecular descriptors that were calculated with MALDI-2 software and encode the two-dimensional structure of the input compounds. The model includes the predicted potency class of the input small molecule, categorized as active or inactive based on the EC50 values, and indicates whether the prediction can be considered reliable or unreliable based on the domain of applicability. You can see here the statistics of the accuracy of the model, and you can visit the model in Enalos Cloud platform from this link. So as a case study, we can use a PFAS molecule from the PubChem database, and we can upload it to the web application. We can either design a molecule, we can also input in SMILES format, or we can upload a series of molecules in SDF format. And also for every of the web tools, a manual is also available with server instructions. It is possible to draw a molecule in the sketcher, and you make use of the different panels and the possibilities for applying different bonds and substructures and construct easily a molecule. And also it is possible to perform virtual screening by designing different molecules in the sketcher, perform different, let's say, modifications, and then pasting them to the SMILES list and create a list of SMILES that can be easily screened through the different models. So here we can input the structure I demonstrated before from the PubChem database. And by hitting the execute button, we have here the prediction of the activity, as well as the neighbors that were used in order to make the prediction. And we can also visualize the chemical space considering all these neighbors, and we can understand different similarities or dissimilarities between the input molecules. And in that way, we can serve the read-across concept. The second model is a deep learning model for the prediction of small molecules enhanced binding affinity to PPR gamma. We retrieved the data from the Tox2110K database that were also screened against the human embryonic kidney cell line. The goals in this case was to identify molecules that activate PPR gamma antagonists, which are of significant importance due to their role in activating processes related to insulin sensitization and the regulation of glucose and lipid metabolism. For this purpose, we perform molecular docking calculations using the analysis Clay-Pios workflows, targeting the PPR gamma Homo sapiens structure. And according to the molecular docking scores, we categorize the molecules into two distinct classes, strong or weak binders. Then we built a robust deep learning model using the DeepChem package integrated in the Keras deep learning framework, using the fingerprints of the chemicals included in the library. Again, the model is available through the Generous Cloud platform, and again, using SMICE or Sketch or the STLF file, we can classify one or more molecules are strong or weak binders, depending on the high or low binding affinity. Here you can also see the statistics of the deep learning model. Again, I will use the same molecule for demonstration. We can draw the molecule in the sketcher, hit the execute button, and we can have here the result, either a strong or weak binder, and we can download also the results. And the last model is a consensus model for the prediction of PPR gamma cytotoxicity of small molecules. This model uses the same data derived from the Tox2110K chemical library, and we assessed the biological activity through the PubChem database, and we calculated molecular descriptors, again, that encode the 2D structural characteristics of the molecules. Then we built a consensus model incorporating three distinct modeling methods: the random forest model, a k-nearest neighbors model, and the support vector machine model, in order to classify the small molecules as active or inactive. And through the majority vote, it is possible to enhance the accuracy of the final predictions. So apart from the molecular descriptors, we also incorporated in these models the binding affinity that was calculated in the previous model based on the docking. And it is possible to bridge these two models using the Enalus APIs. So we can access directly, again, the Enalus Cloud platform, just import a structure and gain a prediction about the activity and the reliability of this prediction. Again, we can use the same example, draw the molecule, and have here the result of the majority voting and the reliability of the prediction. So to sum up, by synergizing machine learning techniques and cheminformatics, the models can effectively predict the PPR binding affinity and cytotoxicity. And this is particularly interesting in the fields of drug discovery and toxicology, and is important for the development of PFAS alternatives, because by understanding the PPAR and PFAS interactions, we can understand how PFAS are transferred within the body. All the models are available in Enalus Cloud platform, and all the data are uploaded in the Zenodo database. So this is all from me. Thank you very much.
Dimitra,
and I will
thanks
give
a lot.
the floor to Perikles.
Yeah, thanks.
Okay, hi everyone. I hope that you can all hear me.
Yep, perfectly.
And hopefully now you can all also see my screen, right?
For the moment, yeah, okay.
Okay. All right, first of all, I would like to extend obviously my gratitude to the organizers of this webinar. So I'm going to present to you the development of biokinetics models, algorithms and web applications within the Scenarios project. Skipping the introduction, since Dimitra presented Scenarios, what we first started doing in Scenarios was that we scanned literature, we recognized all available physiologically based kinetic models, and we created the hub of models in our in-house platform Jackpot, which can also be accessed by other researchers. We also, since we replicated the model using our custom R code, we have an open access repository of these models. This platform offers the ability to obtain predictions either using the user interface of the platform that has a built-in module for both acquiring predictions in a tabular format, but also a graphical representation through concentration time curves. And the models that are uploaded on the Jackpot platform also have their own APIs, so they can be easily integrated into computational pipelines using just a few lines of code. So to whomever has some models and wants to deploy them over the web, or to scientists that want to access these models, please contact either me or Francesco Dondero, who is the coordinator of the Scenarios project, in order to have a B2B meeting, a face-to-face meeting, or an online meeting to just explain how to do this. Apart from deploying over the web existing literature models, we also develop our own models. One of these is a Daphnia Magna model, which is a model for actually explaining the bioconcentration patterns observed in different PFAS in Daphnia Magna. We used the dataset of Wang et al., which reported the internal burden of PFAS in Daphnia Magna under 3 different temperatures. And in order to retain identifiability in the fitness process, we used some global, so to say, parameters. For instance, the uptake rate was set globally. Yeah, I forgot to mention, obviously, that this is the structure of the model. So we considered an unbound space inside Daphnia Magna and a bound space where PFAS were bound to proteins, in order to see if this structure can explain the observed differences between the 13 PFAS included in the dataset. So the model had the uptake rate as a global parameter, and then it had the association constant expressed through K on and K off, and an elimination rate. This structure was able to explain the observed differences. For instance, short chain PFAS tended to quickly excrete out of the body, while longer chain PFAS accumulated inside the body. And you can see that the log of the association constant is in line with this pattern. So short chain PFAS tend to bind strongly to proteins, while longer chain short chain PFAS tend to bind less strongly, to proteins than longer chain PFAS. And interestingly, these values are in line with published values of protein binding of PFAS to other proteins like serum proteins, albumin, etc. And also, in terms of elimination, short chain PFAS have a way higher elimination constant in relation to long chain PFAS, which can be attributed to some of the identified reabsorption processes. Another model that we have developed is a model for explaining the biodistribution of PFOS, PFOA, PFBS, PFHXS, and PFNA in rainbow trout. In this model, we incorporated enterohepatic circulation with some bile-related data that we found in the literature. And we also tested the urine reabsorption hypothesis in the fish. And we fitted the model on various published biodistribution data and tried to see which mechanism explains better the observed biodistribution. So we got satisfactory goodness of fit on the observed data. And the key point here is to highlight that the enterohepatic circulation seems to play an important role in the biodistribution process in rainbow trout. But since we had an identifiability issue, we also recognized that excreta measurements would be really valuable to build an identifiable, more mechanistic model. So the previous model that I showed for rainbow trout was built using physics-informed neural networks, which is an algorithm that combines deep learning and physics-based equations. What it actually does is that it takes information from both a neural network that is fitted on the data and a system of ODEs that express the mechanistic relationships of the underlying biodistribution. This is a really powerful tool for solving inverse problems, which are problems where you need to estimate some parameters through model fitting on the data, but also accelerate a lot forward problems, which are problems where you want to go from an exposure scenario to internal to just solve the equations and estimate the internal concentration time profiles. This spin framework estimates just the concentration time curve, but in literature we often find cumulative statistics, population statistics that are described usually with a mean and a variance. So while pins are highly accurate in providing predictions even in data scarce environments due to their mechanistic component, they lack the ability to harness these population statistics that are recorded in literature. So we wondered whether we can extend this PINS algorithm to facilitate statistical learning, and we came up with a new framework within PINS, which we call distributional PINS, where statistical learning in these artifacts is enabled through distributional assumptions. So you can incorporate some distributional assumptions within the ordinary differential equations. And instead of just predicting a single output, you predict the mean and the variance of this output, which is then translated into statistical distributions inside the ordinary differential equations. So in other words, this framework can predict not only this point, this mean point, but also the variance of its corresponding point within the time evolving phenomenon. We set up a proof of concept with a simple empirical model that describes intervention injection in a 3-compartment system, where you have the central compartment representing the blood, the peripheral compartment representing the various organs that the compound is distributed to, and the excreta, which this system is expressed by this simple set of differential equations. And we draw 10 different sets of parameters. This problem involved 3 different parameters, K1, 2, 2, 1, and K elimination. So in this way, we draw 20 sets of different parameters, which represented 20 virtual patients. And we summarized all this data in time through a mean and a standard deviation. So we created a plot that looked like this. So we then used the distributional pins to estimate the initial parameter distribution from the observed data. So we got the concentration time profiles, and from this concentration time profile, we wanted to retrieve the distributions of the parameters. This is the plot that presents how the model predicted the means and the variances. So we see an excellent goodness of fit of the model on the observed data. And then this is exactly what we wanted to achieve, to develop a methodology that can predict distributional outcomes, but through estimating the initial population parameters. So here we see the population distributions in gray, the sample distribution of the 20 hypothetical virtual individuals in orange, and in blue you see the predicted distribution, and you can see that they all 3 overlap. So this shows that PINS can offer a very robust statistical learning method to estimate distributions in kinetic models. And here we compare the DPINS methodology with Hamiltonian Monte Carlo, which is considered a state-of-the-art stochastic parameter learning method. And you can see that the results are mostly the same. But I haven't included this this metric here. This is achieved in a fraction of the time that Hamiltonian Monte Carlo takes in order to provide results. So deep-ins are way faster. They are like they take around a third of the time needed for Hamiltonian Monte Carlo to converge. And over here, this is, I think, my last slide. Yes, over here you can see the forward problem where you want to go from an external exposure into internal burden and estimate the resulting concentration time profiles with the inherent uncertainty. Importantly, pins are way faster than solving forwardly DODs. It took 0.02 seconds for D-pins to yield these results in relation to 1.88 seconds for ODs. And imagine that as we scale up and we include more and more compartments in these models, this difference is going to be even more profound, and it's going to save a lot of time and also energy spent to acquire predictions. So that was all for me. Thank you for your attention.
Thanks. Thanks, Pericles.
You're welcome.
And now we move to the last presentation. Alessandro Roncaglioni, my colleague of Alternative Project, with the in silico approach to support cardiotoxicity assessment. Alessandra is the head of laboratory for environment chemistry and toxicology at Mario Negri Institute. Her research interests are related to the use of computational chemistry methods applied to toxicological and environmental health issues. We in particular focus with in silico approach, like user models that you already saw and read across, and they're using the different regulatory frameworks. And she is graduating in environmental science. I got a PhD in life and biomolecular science. So, Alessandra, this is your time.
Thank you, Federico. Hope you can hear me well.
Yeah, we hear you and we see your screen.
And I hope now in presentation mode.
Yeah, exactly.
Okay, so good afternoon, everyone. I'm going now to introduce you a bit the in silico approach we are using, or part of the in silico approaches we are using in Alternative to support into cardiotoxicity assessment. So cardiovascular diseases are among non-communicable diseases, one of the leading causes of mortality worldwide. Of course, it's a multifactorial disease, bringing together where several factors may play a role, including lifestyle and environmental exposure, and also maybe their combination can be even more important. These effects may be also extremely marked in mature and aged population, and this is the issue we wanted to tackle within the alternative approach, and basically to address the cardiotoxicity of chemicals and mixture. Just to point out that so far the evaluation of potential cardiotoxic effects of chemical and mixture are poorly addressed and regulated, because we started mapping which are the current requirements for in terms of regulation over addressing cardiotoxicity, and this is not, let's say, specifically regulated at endpoint, at least for common chemicals, because of course cardiotoxicity is a common side effect of drugs, and so there are some specific tests that are made in such a kind of area. But still, environmental contaminants may play an important role into address the observed health effects, and they are often not well characterized in terms of potential toxic effects toward heart. The approach foreseen within Alternative is somehow probably similar to the other project presented before. So the idea is to use some in silico approaches and machine learning methods, and to combine them with in vitro models and advanced in vitro models, taking also into account aged cells and their different behavior and combining omics data. And the idea is to integrate all these aspects, all these tools in order to provide potential solution and proof of concept for application towards better assessment of cardiotoxicity. In particular, the Alternative in Silico suite is a battery of computational tools to understand the impact of chemical compounds on cardiac tissues, and we foreseen to use different in silico methods to describe and model the in vitro test system towards toxicokinetic and toxicodynamic description of what's happening within the in vitro test system, and also the very complex test systems which are under evaluation in the project, to address the hazard with QSAR approach, which has been already mentioned, and to work with PBK models to inform over internal exposure and in vitro to in vivo extrapolation. All these tools will be made available into the cloud platform of the project, so that this will be a kind of repository to the data and the models developed over the years. I will focus on one of these approaches, so on the QSAR part, because this is the part we followed more closely in our lab. And how we address this is with the concept of quantitative structure-activity relationship, which has been very nicely introduced from the first speaker, so I don't need to go too much into details right now. But basically, the idea is to predict a kind of biological activity in terms of the description of the chemicals for which this information is available to some kind of molecular descriptor, and to relate these properties with the biological activities. In particular, for the biological activity, rather than starting addressing the apical effects, so mining data for cardiotoxic effects, we started addressing the problem of describing the cardiotoxicity in terms of the adverse outcome pathway, and so applying the concept of describing which are the molecular mechanisms, and in particular the so-called molecular initiating events, which can lead to a cellular response, and then responses at higher hierarchical levels, so in terms of a tissue or organ response, or even at the organismal population level. And so we tried to within the project, there were people working on developing AOPs for cardiotoxicity, other groups involved in alternative, and the goal was to mine data to describe these molecular initiating events or key events leading to cardiotoxicity, and use this data to build machine learning models. So this was the AOP, the AOP described and developed for within alternative. The idea was not to let's say focus on the typical targets that are considered for drugs, for instance, ERG inhibition, but just to model and to describe the AOP that is more characteristic for environmental contaminants. And this is the AOP developed by Scienzano and MUI, so the Medical University of Innsbruck. And we tried to look into the database of in vitro data to collect data for this for the main initiating event and key events involved in the process. So the final key event is the heart failure and an increased mortality rate. We used the data collected within the ICE platform from NIH. that cluster available in vitro data are coming from ToxCast and Tox21 assays specifically for such a kind of effects. So we have a number of assays addressing the inhibition of mitochondrial complexes, mitochondrial dysfunction, and oxidative stress. This is the modeling pipeline we adopted in the project. So as I said, we started with the data collection and data curation for the chemicals obtained from the in vitro test. And we adopted different types of encoders for the chemical information. So rather than using just classical descriptor, we tried to use several different types of encoders and different type of machine learning, artificial intelligence, and deep learning architecture. We are also starting to address the explainability of these models, because you see, any statistical models in light also of the OECD principles will be much more valuable if you can somehow try to rationalize the final effects or the final relationship in a way that it's, let's say, transferable to a regulator. To encode the chemical, we tested, as I said, several machine learning models and artificial intelligence approaches, and we also tested a variety of encoders for the chemical information. So starting from classical molecular descriptors, Morgan fingerprint, graph, word embedding, and CDDD descriptors. With the aim to assess the best combination of modeling algorithm and descriptors for each endpoint, and systematically evaluating all the possible combinations. To start addressing the issue of explainability, which of course has a little bit to be expanded in the future, we used two approaches, SHARP and LIME. So SHARP is based on the game theory, and the SHARP values interpret the impact of having a certain value for a given feature in comparison to the prediction that we could make if the feature was set to a specific baseline value. While for the LIME approach, it's a perturbative approach where the model, even though it may be very complex at a global level, it could be easier to be approximated around a specific instance, and in this case we can perturb this instance and see what's the effect of this perturbation. For the data collection and data curation, we included only the compound that passed the QC process and so as a positive QC label within the data set. And any chemical was classified as active if the result was a positive call in at least one of the assay, or negative if all the assay were set to negative. And the SMILES were created in order to have a standard canonization, removing salt and counterions, so a classic procedure to prepare the dataset for modeling. These are the three data sets we pulled out. So you may see that the number of compounds present in the data set is quite different. We have smaller data sets with few hundreds of chemicals, and a bigger one with tens of hundreds of compounds. Also, something that is often happening with in vitro data is that there's a kind of very unbalanced population. So you may have one of the two classes, in this case active or inactive, that is overrepresented, and so this is something that usually can require specific attention over the modeling phase. These are the results obtained with the machine learning models, and as I was mentioning, for instance, to cope with the unbalanced distribution of the data, an oversampling method was used, based mainly on the smooth algorithm which creates a synthetic example for the minority classes to increase the number of compounds with synthetic compounds. You may see that for at least 2 out of the 3 models, the 3 endpoints we addressed, model descriptor were the ones giving the best results. And for the last model, which was based on the largest data set, the latent description to CTDD descriptors was providing the best results. Just for the last data set, so the one with the largest amount of compounds, so we also employed a number of artificial intelligence and deep learning algorithms, and in this case the last row is the best, so it's the best machine learning model, and you may see that the AI models were mostly outperforming the best machine learning model, and in particular the natural language processing augmented, so where the chemicals have been encoded through SMILES, and the text vectorization and the character embedding, and the number of compounds have been virtually augmented through including multiple SMILES for the same chemicals, was providing in general the best performance on the test set and in cross-validation trials. By analyzing also the influence of the splitting, we tried to increase the number of chemicals within the training or the test set. And you may see that while for the machine learning approaches, the increase of data within the training set was, so the split ranging from 70% of compound in the training set to 90% of compound in the training set, the difference were not that high. There was an increase in performance for the multimodal model and the NLP augmented models. As I said, we started also to address the explainability, so to understand the importance of the descriptors for the machine learning models and their role in predicting the final properties. And similarly, for the model on the larger data set, we used the SHARP approach and trying to understand which role has the descriptor in increasing or decreasing, and the strength of this relation in increasing or decreasing the activity. To conclude, we developed some machine learning models and AI models to assess the potential cardiotoxic effect of chemicals belonging to different classes, such as pesticide, drugs, and industrial compounds, based on the linear AOP developed specifically for cardiotoxicity for the alternative project. The focus was given to the potential hazard of chemical acting through the inhibition of mitochondrial complexes, increasing oxidative stress and mitochondrial dysfunction, since these were the most common mechanisms that have been observed for environmental contaminants. And AI models outperform machine learning methods when the conditions are favorable. That is when the amount of data is enough to, let's say, this more advanced technique really having a major role in the modeling part. These models will be available in the alternative platform, and the main idea, as I said, is to integrate the different tools developed within alternative to provide an overall framework to assess cardiotoxicity. The idea is to use such kind of models as a first year into an integrated approach to testing and assessment, so into IATA. To conclude, I'd like to thank all of you and the project partners working on the matter, and I'm glad to stay longer to take any question.
Thank you, Alessandra. Thank you all. So we are in time to do the session of question and answer. So I think we can start. If there are someone that want to ask something to our presenters, so please go ahead. If there is someone, don't be shy. Okay, in the meantime, I would ask to Dimitra something about, I see that you use normally, for example, I work with in vitro cells, so I'm on this side of the part of the project where we provide the data, and I see that there are some in vitro data that you use is based on toxicity and cell viability and so on. So this data feed your models, but there is something that you use for validation in the real setup. For example, you perform, there is someone in the group that perform again the same data, the same test to validate your models, or in terms of validation?
Yes, the validation of the models comes from the data themselves. So a part of the data is used to build the models, and we hold out some data of the same data set and we assess in, let's say, the same property. Unfortunately, we are not validating the models on, let's say, completely blind data set. Okay.
So that's because every time it's a huge problem, this validation that is required by regulatory bodies, and I don't know if you in scenarios have think about some potential solution about the validation in general for all these type of experiments, or not, or I don't know if you have some specific task activities in the project related with this aspect on regulatory aspects in particular.
We will try to validate the models on the PFAS and that are generated within the model and within the project. So we have already screened some of the, let's say, interesting PFAS with the models, and we will continue on this path. So yes.
Okay. And for Pericles, so the model is are all available on the website and can be integrated with the other platforms. So at the end.
Yes, exactly.
Yes, because this is interesting also for us, eventually considering the different aspect of the different aims of the project, but also in alternative, as said by Alexandra, there are some, our models will be available on our platform and can be effectively merged in case if there are some point of connection. There is a raised hand by Michael. Michael Dooley, please.
Hi there. So I was just wondering, when I think about PFAS in particular, and this is kind of a broad question aimed at anybody, when I think about PFAS in particular, they have lots of really unique molecular behaviors, like their surface activity and their helicity. Do you feel that these models capture these really unique aspects of PFAS?
Michael, the question is for? Sorry,
it's
just
kind of broad. I mean, because
okay.
everyone used the the same partition coefficient things?
More or less, more or less. But in particular scenarios, 0PM and promises, we use other type of compounds. But I don't know if the guys from scenarios have an answer on this aspect. Dimitra, Pericles, or Alessandra, if you have some.
I see Francesco who raised his hand.
Yeah.
Maybe I can follow up.
No, just a comment. It's a very smart question, Michael, and I completely agree that we must be very careful and we must build specific models for specific group of PFAS, or however, considering the domain of applicability of the models. This is a very important features, and scenarios is contributing in that. Just also to answer to Federico that we have a full work package that is enabling empirical data. So we are doing toxicity tests with a bunch of 44 PFAS. And however, yes, we are trying to converge and to identify a way to use a single model to include the most number of congeners, but this is very challenging.
Clear.
Thank you.
Varso? I see
yes,
another.
It's me, yes.
Yeah.
I just wanted to follow on that. In order to be sure about how the predictions of the models are reliable for different PFAS, we are really have to assess the domain of applicability of these models, and in a way to measure the similarity of the query PFAS, let's say, to the compounds that were used to train the model. So if PFAS is very dissimilar from one of the compounds that are used to train the model to the compounds that are used to train the model, we consider this prediction unreliable. So this is a way to enhance the trust of the final user to the models.
Okay, I was curious about whether or not it could tell that, but that's great. Thank you.
Yeah. There are ways to measure the similarity between the molecules, different measures of similarity.
I see another hands from Jose Apianto. Jose, please.
Hello.
Yeah.
First of all, thank you very much. Yes, my name is Jose. I'm currently doing PhD at l'Université Paris-Saclay in France. And then my work is also related, similar with all the speakers regarding the simulations or predictions of organic contaminants. But then I have a questions about, there are currently a bunch of molecular descriptors in many different softwares. Like I just wondering how we can select appropriate molecular descriptors to our work. I don't know, maybe this question is applicable for most of the speakers. Thank you.
I can start maybe.
Yeah.
Thank you. Well, we try to employ different ways to encode chemicals exactly to see if anyone was superior to the others. And okay, in general, we saw that some descriptors were somehow performing better than the others. Another point anyhow that surely has to be taken into account since the very beginning is also the easiness for the calculation. So whenever then it's easy to transfer them to other groups or not, and that's also pretty important then to ensure the applicability and the transferability of the model to other people, because also in the first talk, we saw that also starting from published model is not that easy to somehow replicate results, even though when there are maybe codes deposit GitHub source in places.
The other guys, if you want to add something.
Yes, I can also speak for our part. We are also testing, we are calculating descriptors from the to the structure of the, let's say, of the SMILE, from the SMILES or from the of its, let's say, compound. And then we apply different machine learning and statistical analysis techniques in order to understand which one of these descriptors is more related to the endpoint of interest. So it's and then, as in the last model we have presented, we also try to use descriptors that are meaningful and add, let's say, information about different aspects and chemical and we are trying to add information on the chemical behavior. So we use, let's say, a hybrid approach using statistical analysis and information about either from literature or from, I don't know, a specialist, etc.
Thanks a lot.
Okay, thank you very much.
Just in the meantime, my just curiosity, because my work is focused on cells, and in alternative we test cardiomyocytes, so it's very specific in cardiotoxicity, the work that we perform on alternative. In scenarios, do you have some specific models in terms of specific toxicity that you want to study? Because PFAS has a different type of toxicity in different type of tissues, but you focus on specific ones, or it's quite general, just to observe in some way the cell toxicity, or a specific cell toxicity? That's the question. I don't know, between Dimitra, Pericles, or also Francesco.
I don't know, maybe Francesco wants to take this one, or if not, I can definitely answer.
Okay.
Okay, so yeah, I'm gonna be the one answering. So yeah, we investigate different endpoints with different types of assays. We're not in the experimentalist side of the project, but from what I know, we are doing PPRA alpha. We're also doing, we focus on different cell lines. We focus on hepatocytes in A56-9. I cannot recall which one is the lung cell. We also use kidney cells, and we do cytotoxicity tests. We initially finished the cytotoxicity tests. Also blood peripheral cells, PBMCs. We focused on the PPAR alpha induction, and from our partners in BFR, they're currently doing some cell lines, some tests in the endocrine system, if I can recall correctly. So yeah, we're investigating several different endpoints.
Okay, perfect. It was just my curiosity about this aspect of the work. Okay, I don't know if there are other questions. Gazik, Miguel, sorry. Please.
Hello, can you hear?
Yeah, perfect.
Okay, thank you. I'm representing Lifesaver Project, which is working for pregnant women and exposure. So a general question is that we have seen many models which is working mostly on mechanism and adverse outcome pathways and everything like that. What we've seen when we developed the in vitro testing system for regulative purposes, there is also an effect on time on exposure. So is anyone in the project, which is we seen today, working on how much would be effect if you have an acute exposure or prolonged exposure? Because at that time, when you only have dose response curve, the time coordinate is missing. So and that because it's related to, in our case, for example, for placental transport of the compound through maternal to fetal bloodstream, it's create a very big uncertainty if this time coordinate is not included. So just for curiosity, is anyone is also looking for this time coordinate?
I can say from for alternative that we perform experiment collecting samples in different time points from a few hours until 7 days of the of treatment with chemicals, and for each time point we try to perform omics analysis so we can see a time course of the different pathways in terms of proteomics, transcriptomics, metabolomics. So that from our side, in some way, we collect, we take into account also this aspect, and yeah, we do it in this moment, this part.
Because taking into account that we will have also in time coordinate metabolic products and everything which comes on that, you can make it as complex as possible. And in this way, my question was, it's related to all these models. Is this the same model actually applicable for the different time points, or is there something which is still missing which we need to address? Because maybe not all the machine learning or in silico models we have seen, they are valid through the whole time of exposure. So maybe it's just kind of a discussion topic, but I think that may be good to that somebody that too.
It's interesting. Francesco?
Yes, in scenarios, we are addressing the long-term exposure in fish. So we are using zebrafish, and long exposures means up to 6 months, and we are considering the parental generation F0 and F1. But this is another task of the project, okay?
Okay, thank you.
Cheers.
If I may add to the previous point that Gasek raised, if I pronounced it correctly, I think that's a very interesting point in terms of performing in vitro to in vivo extrapolation. You need to compare similar things. So if you want to connect an in vitro result that was taken under 24 hours of exposure with a physiologically based kinetic model, you should it's going to be way safer to compare the resulting exposure using the PBPK after 24 hours and not after, let's say, several days, because you exactly have this time component which is not taken into account in the extrapolation process.
Charistos Periklos. What I mean is that if you have a different compound, like you have a different perfluorinated compounds, and if you take the same one point time all the time, maybe some of them, they have a different, what we call drug transport signature, which means that it's not just permeability, but the kinetics of penetration on that. So if you think you have the same dose at the same time, but the different compounds may reach the target in a different rate. So the question is also that maybe this is one of the things, at least what I did not find, in a normal pharmacokinetics, because sometimes people just, forget about that. And if you look for this different, as was mentioned in one of the presentations, that different compounds may have quite different transport properties, even if they look the same adverse outcome pathways or whatever mechanism, but the same dose of the different compounds in the same time may have different effects.
Yeah, that's a great point that everyone needs to take into account, I think.
Okay, thank you.
Okay, I don't know if there are other questions. I don't see nor raise. No, Tom. Probably no. I
sorry,
see.
mistake.
Don't worry, Tom. Don't worry. Okay, if there are no other questions, I think that we can close here the meeting, the webinar. I wanted to thank all the presenters, all the people involved, all the people that participate in the meeting, in the webinar. Sorry, and as I said when we start we try to disseminate the video as much as possible. As alternative, we will upload on our website. I ask you also to the other project to do the same. And I think that for today it's all. And we try to organize. We organize another one, as I said, for the end of the year or the new year. And thanks a lot again to everyone, guys. Thanks.
Thank you, Federico. Ciao.
Thank you very much.
Bye-bye.
Thank you. Bye.
Thank you. Bye.
Bye.